Welcome to this video where we'll explore celiac disease, a complex autoimmune disorder that can significantly impact the nervous system and overall health. We'll delve into the causes, symptoms, diagnosis, and management of this condition, providing you with a comprehensive understanding. Celiac disease is primarily triggered by gluten, a protein found in wheat, barley, and rye. In genetically predisposed individuals, gluten ingestion initiates an immune response that damages the small intestine. While gluten is the trigger, the disease isn't simply an allergy or intolerance. It's an autoimmune condition where the body mistakenly attacks its own tissues in response to gluten. The pathophysiology of celiac disease revolves around this aberrant immune response. When gluten enters the small intestine, an enzyme called tissue transglutaminase modifies the gluten molecule. This modified gluten then activates immune cells, specifically T cells. These activated T cells release inflammatory substances that damage the villi, the tiny finger-like projections lining the small intestine. Villi are crucial for nutrient absorption, and their damage leads to malabsorption of essential vitamins, minerals, and other nutrients. This malabsorption is a key factor in many of the symptoms associated with celiac disease. Importantly, neurological manifestations arise from both the autoimmune process itself and the nutritional deficiencies resulting from malabsorption. Celiac disease affects approximately 1% of the population worldwide. Although many cases remain undiagnosed, it can occur at any age, but is most commonly diagnosed in childhood and early adulthood. There is a higher prevalence among individuals with a family history of celiac disease or other autoimmune disorders. Certain ethnic groups also show a higher predisposition. The signs and symptoms of celiac disease are incredibly varied, making diagnosis challenging. Digestive symptoms are common and include diarrhea, abdominal pain, bloating, gas, and weight loss. However, many individuals experience non-digestive symptoms, including fatigue, anemia, skin rashes, dermatitis herpetiformis, bone pain, joint pain, infertility, and even neurological problems. Neurological manifestations can include peripheral neuropathy, nerve damage, ataxia, loss of coordination, seizures, headaches, cognitive impairment, and even depression or anxiety. It's the presence of these diverse symptoms, often without prominent digestive issues, that can lead to delayed diagnosis. Diagnosing celiac disease typically involves a combination of blood tests and an endoscopy with a biopsy of the small intestine. Blood tests can detect elevated levels of certain antibodies, such as anti-tissue transglutaminase, anti-TG, and anti-endometrial antibodies and EMA. If blood tests suggest celiac disease, an endoscopy is performed. During this procedure, a small sample of tissue, a biopsy, is taken from the small intestine and examined under a microscope to assess villus atrophy, a damage to the villi. It's crucial that individuals are consuming gluten-containing foods during testing to ensure accurate results. While there aren't distinct types of celiac disease in the traditional sense, it is often categorized based on the presence and severity of symptoms, as well as the degree of intestinal damage. Some individuals have classic celiac disease with prominent digestive symptoms, while others have silent or subclinical celiac disease with minimal or no noticeable symptoms but still have intestinal damage. Refractory celiac disease is a rare condition where symptoms persist despite following a strict gluten-free diet. Finally, potential celiac disease describes individuals with positive antibody tests but normal intestinal biopsies. They are at risk for developing the disease in the future. The cornerstone of celiac disease treatment is a lifelong, strict gluten-free diet. This involves eliminating all foods containing wheat, barley, and rye. Careful label reading is essential, as gluten can be hidden in many processed foods. A registered dietitian specializing in celiac disease can provide guidance on navigating a gluten-free diet and ensuring adequate nutrient intake. In some cases, individuals may require vitamin and mineral supplements to address deficiencies caused by malabsorption. For those with refractory celiac disease, medications such as corticosteroids or immunosuppressants may be necessary. Currently, there's no definitive way to prevent celiac disease in those who are genetically predisposed. The best strategy is early diagnosis and adherence to a gluten-free diet to minimize intestinal damage and prevent long-term complications. Family members of individuals with celiac disease should be screened, as they have a higher risk of developing the condition. The prognosis for individuals with celiac disease is generally excellent with early diagnosis and strict adherence to a gluten-free diet. Intestinal damage typically heals, and symptoms resolve. However, untreated celiac disease can lead to serious complications, including anemia, osteoporosis, infertility, neurological problems, and an increased risk of certain cancers. Recent research is focusing on developing new treatments for celiac disease, including enzyme therapies that break down gluten in the digestive tract and immunomodulatory drugs that target the underlying immune response. These advancements hold promise for improving the lives of individuals with celiac disease in the future.